So the DiRECT trial is a really interesting trial because it's looked at the effects of using a meal replacement strategy followed by a really quite intensive support program to try and get people into diabetes remission and keep them there. And I think as somebody who's always been interested in weight management, I think the fantastic thing about this study is that they managed to get a high proportion of people to lose weight and a reasonably high proportion of those people to actually maintain that weight loss over 2 years, which is really good. And some of those people have gone into remission of their diabetes, and that diabetes has stayed in remission. The challenge, of course, is that is still a relatively small proportion of the people with type 2 diabetes. If you look at the numbers of people that were approached to take part in the trial, more than 1,500 people, just under 140 actually agreed to take part, and of those, about a third remained in diabetes remission after 2 years. So if you look at it from a perspective of all the people with diabetes, it's a relatively small number who seem to be able to buy into this. It proves the point of principle that this can work and it can be really effective for those people who are able to engage for a long-term study. But whether it's something that would be a universal solution for the vast majority of people with type 2 diabetes, I think we have to wait and see. I think it's very interesting that when we talk about these types of approaches with patients, some people have actually tried these approaches in the past and either had transient success or have not succeeded. One of the biggest problems, of course, is that when the DiRECT trial, all the food, the diets were provided free of charge for the patients. And one of the challenges that I have in my weight management practice is that when we suggest to patients that they might want to use a meal replacement strategy as part of the way of managing their weight, given the fact that we do have good evidence that it's effective, is that a lot of patients find it very difficult to afford that. And I think that's going to be a problem when we come to implement the DiRECT study as well. I think the mechanistic side is reasonably well done, although there are still some questions about whether at what point in the natural history of diabetes we would expect this effect to not be as effective because of the ongoing decline in beta cell function that we know happens in people with diabetes. So there is a question about at what stage in diabetes is this really very unlikely to be effective. They chose 6 years duration as the cutoff for the DiRECT study. Whether that's right or not, I think we have to wait and see. I think the key part is going to be actually how you implement this into the real world. At the moment, most people with type 2 diabetes are given some support about diet and lifestyle, but nothing like as supportive and as aggressive, if you like, in terms of weight loss as was offered in DiRECT. And then we tend to use medications which are reasonably effective, but of course have adverse effects. Now, for some people, not having medication and being able to effectively remove that label of diabetes is fantastic, but actually how we implement that into real-world clinical practices, I think, is going to be the biggest challenge. And I know that the NHS in England, at least, is looking at this in a very serious way and hoping to run a pilot project in a significant number of people over the next few years to see whether this can work in the real world.